Ladies and gentlemen, please welcome back to the stage, Chris Matthews.
Thank you. Now we're going to hear from another keeper of the Kennedy flame, if you all will kind enough to take your seats. Just to give you a sense of how well Ted has carried on his family's legacy of public service, consider this. Not long ago, his own son, Ted Kennedy III, confidently declared that he plans to become the senator from Massachusetts. At the time, Ted was 11 years old. Edward Kennedy Jr. is here as a public health advocate as well as a Kennedy, of course, and like many in his family, his commitment to quality health care for all is not just a professional one. When he was only 12 years old, as many of you know, Ted was diagnosed with a rare bone cancer and had to have his right leg amputated. Ever since, Ted has been passionate about health care reform, standing tall on behalf of people with disabilities. Ted spent his career working for nonprofits on public policy and disability-related issues. He's been a teaching fellow on disability policy at the John F. Kennedy School of Government and continues to fight for disability rights as an attorney. Ted has also served on the boards of the Special Olympics, the Very Special Arts, Connecticut's Office of Protection and Advocacy for Persons with Disabilities, and the American Association of Persons with Disabilities. Ted understands from personal experience why it's so important that mental health be integrated into our healthcare system. He knows that other diseases and factors can influence a person's mental health. When he was diagnosed with cancer, he says he received medical treatment, but there was virtually no recognition of the need for psychosocial supports. Here's his words. I remember the emotional isolation I experienced, losing my hair, and dealing with that as a seventh grader. No one ever asked me how I was doing or thought that my mental attitude would have an impact on how I approached the challenges I faced, even though my parents found the best, most brilliant doctors that existed at the time to treat the cancer in my body. No one really ever addressed how I was doing emotionally. And at his father's funeral, as everyone remembers, Ted Jr. talked about what that emotional battle was like. A few months after Ted Jr. lost his leg and had it replaced with an artificial one, he and his father, Ted Kennedy, went out sledding. We all remember this story from that night. The hill was covered in ice and snow, and Ted Jr. slipped and fell. Like any 12-year-old would, he started to cry. He told his father he would never be able to climb that hill. But his father lifted him up and said, there is nothing that you can't do. We're going to climb that hill together, even if it takes us all day. And that's what this forum is about, climbing the hill toward fully equal mental health. Ladies and gentlemen, please welcome one of the men leading that climb, Mr. Edward M. Kennedy, Jr.
Thank you. I've got my brother Patrick here leading the cheering section. Honestly, I'm here to make an award presentation, the Kennedy Forum Community Mental Health Award. But before I do, I just want to say, Patrick, a word to you, how proud I am of you. And I know that you and Dad worked on so many issues, but the signature issue of your career working with Dad, with you sponsoring mental health parity in the House and Dad sponsoring mental health parity in the Senate, I know how proud he would be to see you on this stage leading the charge together with all these people in this room, committing yourself to this cause. Patrick, well done. See, Patrick had something for me to say, and I said, you know what? I'm going to be on the mic. I can say whatever I want to say. No, but in all honesty, I get the opportunity tonight to introduce and recognize a person who has been a true revolutionary in the field of mental health, Dr. Aaron Beck. And most of you who have dedicated your lives to improving the status of people with mental health conditions know that Dr. Beck is one of the reasons why we are here tonight. He created a new paradigm for psychotherapy. He has led so much of the field of progress in the area of mental health, and he is known, obviously, as the father of cognitive therapy, one of the most influential psychotherapists of all time. And what's so unique about what he did and what he continues to do is that he was able to develop and assess depression, anxiety, and other mental health condition and set the standards that are quantifiable and measurable outcomes for treatment. He's the author of numerous books on anxiety disorders, depression, suicidality. He is the recipient of numerous awards, including the Lasker Award. He was educated at Brown, Yale, has held academic positions at Harvard and Columbia, and now Professor Emeritus at the University of Pennsylvania. His mission is going to live on because he works very closely with his daughter, Dr. Judith Beck, who is also here with us tonight, who in her own right is a leader in CBT research and training. So thank you so much, Dr. Beck, for being here tonight. I know how much my brother Patrick admires you. I know how much the Kennedy family admires you. And it is my honor tonight to recognize you as the inaugural recipient of the Kennedy Forum Community Mental Health Award. Congratulations.
Well, first, I'm overwhelmed. This is such a wonderful honor, and I'm also overwhelmed at the enormous progress that I see ahead as a result of what Patrick Kennedy has wrought. And I want to thank all the people who have contributed to the program tonight. In the past, people have asked me, how did I first get interested in depression? And I said, when I was growing up, I was a Red Sox fan. But now that the Red Sox have turned the tables and are in the World Series, and not just for the first time, I'm going to have to study manic disorders. And I'd like to share with you some observations I've made for over 60 years in the mental health field. I think it's good to go back in time because people don't realize just how much progress has been made. My first introduction to psychiatry was seeing The Snake Pit. I don't know how many people have ever seen that. And then I got a first-hand view of what happens in mental hospitals when I was making a tour of a hospital. And the first ward I went into, the patients all seemed to be asleep. And I said, well, that's interesting. And what's going on? I said, oh, they're getting insulin coma therapy. And the next ward I went to, many of the patients had yellowed skin, and some of them were convulsing, and some just seemed to be very febrile. I said, well, what's going on here? And they said, oh, well, they're getting treatment for neurosyphilis with the use of the malaria bacteria. So they're getting injections of malaria. And then finally, I was getting a little discouraged, and I got into another ward, and people walking around mostly with shaved heads. They seemed to be very docile, and they had scars in their head. And that was because they had all had lobotomies. Well, I thought there must be a better way, so I changed my plans and I went into neurology. But eventually I came back to psychiatry. And then over the course of time, of course, things changed a great deal. One of the important changes was the introduction of the antipsychotic drugs. The problem at that time, however, was that there was no way of keeping patients from coming into the hospital because they would get sick. So there was no way of treating them in the community. And once they left the hospital, there was no way to prevent them from coming back. And so the next landmark actually was the Community Mental Health Act, which then provided services to the mentally ill in the community. But in more recent years, there's been a trend towards what is called recovery. And the whole idea of recovery is that if the effort is made to reintegrate the patients into the community, they're not only going to be happier and more productive and so on, but their symptoms, the remaining symptoms, hallucinations and delusions in themselves may clear up. One patient, for example, whom we saw recently, had the delusion that there was a gang out to persecute him. And there was no way in which this delusion could be helped. However, we did establish some of the principles, what we called recovery-oriented cognitive therapy, and he went out into the community. He got a girlfriend. He started living independently, and he got a job. But what's interesting is that he still had his delusions and hallucinations. So what the recovery movement has shown is that we don't have to be so symptom-oriented. We want to try to treat the symptoms as much as we can. Thank you. But we have to think of the person as a real person who's been marginalized and needs to get back into society. And so I see a trajectory going on, like with the Boston Red Sox, which came from the pits. And I see the same for the mental health movement, the way we're going now. So thank you.